gotta just keep holding.
No, it's recording. It says it's recording. No?
Okay, perfect. Yeah, I just wanted the front of the shirt on.
Does it say recording there?
Yep, perfect. Beautiful. Welcome, Vicky.
I want to remind people to please watch the meters. They will ticket you if you're over time, and we'll get this thing going. So let's send a message to our government and make some noise. During your rally today, there's people over here with balloons, and I welcome you to put messages for Minister Matthews on the balloons, and we will either be tying them to her porch or we'll be giving to her in some fashion. So you can go over, and there's magic markers and balloons here. Throughout the rally, if you could do that, that would be great. So our speaker today is going to be Natalie Mera. Natalie is the Executive Director of the Ontario.
You go over and say it. Finally.
An organization representing people in its network, which encompasses more than 70 local chapters and more than 400 organizations across Ontario. She has spent the last 14 years building a health coalition into the largest, broadest public interest group of healthcare in Ontario. Of our public services, including our hospitals. It's particularly important that we meet here today in London to send a clear message to this government to stop the hospital cuts. All across Ontario, and especially all across southwestern Ontario, we have seen massive cuts to nurses, to hospital beds, to health professionals, to the support staff who make our hospitals work and are vital to patient care. We have seen the decimation of services in the small and rural hospitals, as we'll see in a moment, all across southwestern Ontario. We've seen massive cuts to the large town hospitals, and yet in every large town in Ontario, in London, in Windsor, in Sarnia, in Kitchener, the hospitals have already experienced bed cuts for 20 years. Ontario now has the fewest hospital beds left of any province in Canada. We have the least amount of nursing care per patient of any province in the country. Hospitals at the lowest rate of anywhere in the country. Saying, oh, we have 6,000 more doctors or so many thousand more nurses. What they're not saying is, since 2003, it is now 2015, the population has grown. And in fact, we're laying off nurses by the hundreds or even thousands across Ontario. Health professional services are being privatized all across Ontario, and patients have to pay out of pocket for those services. And at the end of the day, we actually have less hospital care left than anywhere else in Canada. I'm underlining this because these are the result of choices. They are not necessities. Our government in Ontario raises the least revenue of any province. Why? Because we've engaged in the biggest tax cuts, mainly for the wealthy and for corporations of any province in the country. We fund all our public services at the lowest rate of any province in the country. That's every public service, from healthcare to our public schools, to our transit systems, to our provincial parks. If you wonder why your children have to pay the highest university tuitions in this province of any province in Canada, that's the reason. If you wonder why you face the most out-of-pocket healthcare costs of any province in Canada, that's the reason. These are choices that are being made on our behalf, and yet the public knows almost nothing about them. We have never been given given a choice about whether we want to see frontline healthcare services cut, whether we want to see our nursing staff force decimated, our small town hospitals gutted of their services, our large town hospitals running at such a state of overcapacity, of overcrowding, that there are stretchers regularly lining the hallways, people waiting for days for beds, ambulances unable to offload because the